Hello, everyone. Welcome to the joint class for Southside Medical Center's elective joint replacement program. My name is Rocky Delk, and I am the Ortho Program Coordinator. The objective for this presentation is to prepare you for your joint replacement surgery. So let's get started. First, there's some housekeeping. At the end of this presentation, please take the time to complete the survey on the final slide. This will help your doctor and I know that you have completed this education and you have included your coach. Bon Secours Southside Medical Center is a medium-sized acute care facility that serves the counties and localities of Petersburg, Emporia, Hopewell, Colonial Heights, Fort Gregg Adams, Chester, Prince George County, Dinwiddie County, Brunswick, Surrey, and Sussex counties, and many more. We have dedicated departments to assist in your recovery needs. The hospital has over 200 private rooms, an emergency department that is open 24 hours, 10 surgical suites within our operating room, and a recovery room with over 15 recovering room areas. And this facility is also located near the orthopedic specialist of Petersburg for your convenience. The current practices for visitation for the facilities are as follows. Face masks are recommended upon entering the facility. Bed availability changes frequently. Our goal is to have you located on 4 South for your recovery after surgery, but this can change from day to day. There is one visitor allowed in the pre-surgical area only if time and space allows. There are visitors allowed on the orthopedic surgical unit after surgery. This visitor can stay the night but must be over the age of 18 years old. There are some specific reasons why you are here at this moment in time. You have exhausted all therapies to treat your discomfort and pain due to arthritis. Hip and knee problems like discomfort, swelling, and stiffness are generally caused by arthritis, and there are two types to categorize that can be treated with a hip replacement or a knee replacement. First, osteoarthritis is the most common form of arthritis and usually begins after the age of 40, often associated with wear and tear being placed on your joints. Secondly, there is rheumatoid arthritis. This arthritis is an inflammatory chronic disease that affects the joints. That includes your hips, knees, shoulders, elbows, wrists, hands, and feet. Rheumatoid arthritis is also an autoimmune disorder. Unlike osteoarthritis, rheumatoid arthritis can occur at any age. For you all that are getting knee replacement surgeries, let's review what that really means. During the total knee replacement procedure, the surgeon will make an incision to access the damaged joint. They'll remove the damaged parts of the joint and replace them with artificial components called prostheses. These components are often made of materials like metal or plastic or ceramics. It can last up to 18 to 25 years if taken care of properly. They are meant to mimic the movement of your joints once you regain the strength and range of motion of your knee. If you have only one side of the knee joint that is being replaced, we call that a partial knee replacement. This procedure goes through the same process as the total knee, but instead of 3 components, you will receive 2 to either the inside or the outside of your knee. For hip procedures, we will discuss basic hip anatomy first. The hip joint is made of 2 parts, the head of the femur, or the ball, and the acetabulum, the socket. You will have these parts replaced during your hip replacement. These parts will be replaced in 3 sections. There are 2 ways the surgeon will enter your hip to remove the arthritis. First, the anterior or the front part of the hip is called the anterior approach. There will be an incision made in the front of the hip, and the doctor will remove the arthritic tissue, replace it with your new hip part. Second approach is making an incision on the side of the hip, and this is called the posterior approach. Preparing for surgery. We're going to go over some steps where you and your coach will need to prepare for surgery and its recovery process. Speaking of coaches, let's talk about the roles and responsibilities of that person that will be taking care of you while you're at home, better known as a coach. Selection of a coach is vital to your recovery and support. Choose an individual that has a strong relationship with you and will love to see you succeed. This individual should be available to you during key events of your orthopedic surgery process. Before surgery, the coach should attend the pre-op class with you, encourage pre-op exercises 3 times a day, assist with scheduling your pre-admission testing appointment, making your home environment safe after discharge, plan to drive you to schedule appointments and to surgery. Finally, the coach should also assist in buying or purchasing equipment for home, such as the rolling walker. Secondly, at the hospital, your coach will bring your walker and or cane with you to the hospital the day of surgery. It will be important to have this specific home equipment for patient physical therapy and measurement. Participate in the patient's therapy process. This way you can understand the patient's exercise, assist the patient with bathing and getting dressed, and while you're at the facility, they will take this opportunity to fill your pain medication and other prescriptions from the pharmacy before discharge. Once you're home, your coach can keep track of all your medications using a pill organizer. You can also use the patient tracker in the education book for the pain medication. Your coach also will help you apply ice every 4 hours to your surgical site, encourage exercising and walking 3 times every day, assist with showering and toileting needs, and also assist with household chores, meal preparation, caring for pets, and or driving to and from appointments. You and your coach will need to prepare your home and other family members and visitors for the first few days after surgery. Take a look at the checklist that's in the front of your folder. Complete the following items in the week prior to surgery. Set up an area to recover. This place in your home should have easy access to the bathroom and the table for remotes, books, and any other entertainment needs that you will need during your recovery process. Also, make sure there's enough light for you where you will recover. This is to help with movement around your recovery spot that may prevent trips and falls. While we are on the topic of falls, let's talk about it. Remove your loose carpets and rugs from around the house. If it is difficult to remove, tack down the edges. Ensure proper lighting around the walk paths to reduce falls. Clear pathways. Ensure no cords, telephone lines, toys, plants, stools, or ottomans are in your walkway. Keep the clutter to a minimum to reduce any falls over these items. Manage your pets. While walking in the next couple of weeks, make sure your pets are not under your feet. Also, we ask that your pets do not sleep with you until you are completely healed. Start planning and setting up your meals during your recovery period. Look at the bathroom. Is the toilet seat too low? Do you need shower bench or a chair to help with washing? This is a great opportunity to seize those items. Arrange for someone to be with you for a few days or a week if possible. You will be scheduled or have completed a pre-admission testing visit. This is a pre-surgical visit where you will be answering some questions to help manage your care during those surgical processes with anesthesia and your inpatient process. Plan to have an interview with a nurse. Some things that will need to be discussed are surgical and medical history. Remember to bring a list of your medications with you. You may also need to complete some lab testing and EKG testing during this visit. Along with your PAT visit, you will get some education regarding what medications to stop and which medications to continue. We have an example of these medications in the next two slides. However, please pay attention to this information during your PAT session. Your information may be more specific to your needs. During your pre-admission testing appointment, the nurse will review all your medications with you. You will be told which medications to stop and which medications to take the morning of surgery. You will receive specific directions about blood thinners. Please pay attention to this. If you have questions or your medications changed before surgery, contact the pre-admission testing department. This number is in the front of your folder. After your pre-surgical evaluation, it is now time to think about getting the items you will need for surgery. A very specific item you need is a rolling walker. You will need this piece of equipment for all your ambulation needs and to complete physical therapy. These rolling walker devices are available at Clay Home Medical or on Amazon. You can also borrow this piece of equipment from your family or friends. Although rolling walkers are preferred, it is fine if you use a cane as well. When selecting a cane, please pay attention to the feet of the cane. The pictures shown here are acceptable while using the cane for ambulation after surgery. In this slide, you will see items that are optional. These types of items are not usually covered by your insurance. These are not necessary for your recovery, but it will make recovery easier. There are some items you will receive during your pre-admission testing. I will be the person delivering them to you shortly after your PAT appointment and will talk you through them. In this bag, you will see an incentive spirometer. Check out the incentive spirometer video to get clear instructions on this device. You will also receive CHG soap. There is a printout of instructions given to you by your PAT nurse. Remember to wash using the CHG bottle in a clean washcloth and towel. Finally, there will be a pre-surgery exercise pamphlet. This information is detailed more throughout your handbook on pages 32 to 38. We want you to be at your healthiest before surgery. To ensure a seamless recovery and to get you back to functioning, let's now talk about healthy strategies before surgery. Controlling your blood sugar. High blood sugar can increase your healing time. To optimize your body's healing ability, let's aim to keep your blood sugar around 80 to 130. If your blood sugar is too high, your surgeon may opt to postpone your procedure until your blood sugar is more controlled. Lose a little weight. If your BMI is exceptionally high for safe surgery. During your PAT appointment, the nurse will take your height and weight and calculate your BMI. If this information tells us that your BMI is too high, you may need to lose some weight prior to the procedure. Stop smoking. It has been found that smoking can lead to poor blood circulation and decrease your body's natural healing abilities. We recommend stop smoking for your procedure at least a week before, 4 weeks before, and 4 weeks after. If you need assistance to stop smoking, there are resources available. In your education book, there is a section for home exercises. Start working on ankle pumps, heel press, and knee bends a week or two prior to your procedure. This will help make those muscles around your knee and hip get stronger prior to your surgery. And finally, start eating a healthy, well balanced diet. Increasing your protein will help promote healing and help your body fight off infection. Pair with your protein some carbohydrates. Carbohydrates give you the energy to complete your exercises daily. Completing pre-op exercises before your hip and knee surgery can improve your chance of a smooth recovery. These exercises are located on pages 32 to 38 in your education handbook. There's also a simplified version in the form of a pamphlet located in your folder. It is proven to help strengthen your muscles. It also counts towards ambulation and can help decrease blood clots. Doing the exercise, ankle pumps, while lying in a recliner or bed is especially helpful. Doing these now can ensure you have a routine that you will be able to follow after surgery. Do the exercise 3 times a day and round about 10 repetitions if you can. The day before surgery, you should expect a phone call from the nursing staff of the pre-admission testing department. This phone call will be in the afternoon prior to surgery. This also means if your procedure is on a Monday, you should expect a call the Friday before. Be sure to communicate your time of arrival with your coach. You will receive specific instructions regarding when to stop drinking and when to stop eating before surgery. Remember that list of medications to stop taking? This list was given to you by your PAT nurse. Please follow the instructions on when to stop eating, drinking, and what medications to take. Do not wear jewelry, makeup, lotions, and/or perfumes. We have special devices that need to attach to your skin. If you were given surgical cleansing soap, take a bath prior to coming to the hospital with this soap, with a clean washcloth, and dry off with a clean towel. Do not shave any areas. Brush your teeth and rinse before coming to the facility. Arriving to the hospital, you will come to the second floor surgical department. Please wear clean, loose-fitting clothing and non-skid shoes. Please report to the same-day surgery department on time. You will then proceed to the pre-op area where you will talk to a nurse that will review your medications, allergies, medical history with you. You will put on a gown, get an IV started, and the surgeon and anesthesia person, Nell, will come to talk to you. During this time, the surgeon will answer any last minute questions and place his or her initials on the correct side of the procedure. The anesthesia provider will ask you any last questions as well, finalizing the type of anesthesia that you prefer and what best fits for you. They will also consider performing a nerve block during this time. You will then put on a hospital gown, get wrapped up in a warm blanket, and begin meeting the OR surgical team. Your coach will leave your home equipment in the car and your overnight bag in the car. They will be waiting for you in the waiting room adjacent to same-day surgery department. The main goal of anesthesia is for you to be comfortable during the process of replacing your joints. It also limits your movement while the surgeon and the operative team works on you. Let's review the anesthesia types that are commonly used for this procedure. With any given anesthesia, you will also get a nerve block for pain control during your recovery, if that is the best course of action for you. General anesthesia is an approach that ensures that you are unconscious and unable to feel pain or move. To manage this type of anesthesia, you, the patient, have a tube placed in your throat, and then you are placed on a ventilator to help you breathe. Spinal anesthesia is a type of anesthesia that places medication in your lower spinal column and block all nerve movement and feeling from the waist down. When using this medication, the anesthesia provider is still there to monitor you, but without having to place a breathing tube or you on a ventilator. Nerve blocks are used to block the feeling in the specific area the surgery is being performed during and after the procedure. Nerve blocks can last several hours or at least a day post-operation. Your limb will feel numb, and you may feel that your limb will be weaker until that nerve block wears off. You will get more information from your surgeon and anesthesia provider the closer you get to surgery. The final choice of anesthesia will take place between you and your anesthesiologist. After talking with your surgeon and anesthesiologist, you are now ready for the operating room. The surgery should last roughly an hour up to 2 hours. After leaving the OR, you will go immediately to the recovery room. While in the recovery room, your doctor will update your family on the surgery and expectations. Your first stop for recovery is the recovery room. Once the surgeon comes and talks to your family, you will head to the recovery room. There, the staff will do the following things. They will make sure your pain is well controlled, vital signs are stable, there is no or limited nausea. You will also get some x-rays during this time, and they will apply ice therapy to the limb in which they did the procedure. You may not remember much during this time period. Remember, you are waking up from anesthesia. You may, however, remember going to your patient room to have a speedy recovery after this. Coming out of surgery can be very disorienting. You will have a lot of new attachments and equipment that will help you in the beginning to your fast recovery. There is a special dressing for your hips and knees. Do not remove it until the doctor tells you to. This dressing has silver properties inside of it. The bandage keeps your incision clean and intact. You will also have sequential compression devices on your legs. This massaging machine keeps blood pumping and decreases your chance of blood clots after surgery. You may also experience ice wraps for hips and polar ice for knees. Keep the ice therapy on your hip and knee most of the time during the day. This reduces swelling, thus reduces pain. You will also see your incentive spirometer. This machine helps you keep your lungs inflated after having surgery. Due to reduced movement in general anesthesia, your chances of lung infections are higher. Aiming to use this machine 10 times every 2 hours while awake can decrease your chance of any lung infection. You may also see your CPAP machine if you have one at home. Bringing this machine to the hospital is very important, as you may spend the night after your procedure. There are some very specific patient goals for you. Try to remember these four things: pain control, moving, no infection, no falls. First, let's talk about pain. This scale shows how you can describe your pain to the nursing staff throughout your visit here at Southside Medical Center. One of the questions you will frequently hear is, "Are you in pain?" On a pain scale from 1 to 10, with 10 being the worst pain you have ever felt, what number is your pain? If the numbering system is so overwhelming at this time, you can use the faces to describe your pain as well. Pain will not go away in its entirety, but you should have pain that is manageable and tolerable. The more pain you experience, the less movement and exercises you are wanting to do. So keeping pain at a minimal or tolerable level is key to your success. Discomfort can occur as soon as 2 hours after surgery. However, with the nerve block, it may not be so intense. As you gain movement and feeling back in your legs after the anesthesia, the nursing staff will give you pain medication according to your pain score. Please stay ahead of the pain, especially at night while you're asleep. Here are some tips to help you control your pain. To decrease the amount of pain you feel, we encourage you to take medications every 4 hours for at least the first 2 days. If the pain medication is not working, you must communicate this to your nursing staff on the fourth floor. We can call the surgeon and get you new pain medication that will help. Apply ice and cold therapy. You would get a polar ice machine if you had a knee replacement. You would get ice wraps for your hip replacement. Please keep this machine and the ice wrap on as long as possible, taking 30-minute breaks when it becomes intolerable. The cold therapy decreases swelling, which in turn decreases pain. Elevating your extremities like the picture above if you had a knee replacement. Key times to elevate your leg after your knee surgery is after exercising and walking and when you're resting in the chair. I know this does not sound like it will work, but moving around and mobility is also a great strategy to help reduce pain. Remember to move in moderation. Too much movement can cause discomfort, and not enough movement can cause discomfort. Aim to walk every 1 to 2 hours to decrease your discomfort level and stiffness of your new joint. Key takeaways for pain. We cannot make your pain go away completely, but remember, we should allow pain to be manageable to optimize your recovery. The goal for pain management is so that you can eat, sleep, and move around without a huge amount of limitations. And remember to always stay ahead of your pain. If it so happened that you did not stay ahead of your pain, remember it can take up to 12 to 24 hours to maintain that pain control again. There are some essential items we need you to remember to help prevent infections. Infections located where you had surgery is the number one reason why most people get readmitted back to the hospital. So to prevent this, follow these steps. Always maintain proper hand hygiene. Washing your hands with soap and water or using alcohol-based sanitizer before touching anywhere close to your incision. This is this also means if you're cooking for yourself or preparing food, after touching said food, wash your hands thoroughly. Keep the dressing that the surgeon applied after your procedure in place and intact. There will be specific directions on how to maintain this dressing once you get discharged from the hospital. We will send home extra dressings if you have had any trouble during your admission. There are some signs of infections to look out for. First, There may be some cloudy-like drainage coming from your incision. Your dressing may be saturated with this drainage. The surgical site may be more painful, warm to touch, have an increased amount of swelling, and may appear red and discolored. Do not confuse discoloration with bruising, which is a normal part of healing. However, if there is a large amount of redness, please do not hesitate to call the doctor's office for advice. Finally, to help with infection prevention, do not sleep with pets, change into clean clothes daily, do not share personal hygiene items like washcloths and soap, and always sleep on clean sheets. While in the hospital, you will receive CHG wipes to wipe around the dressing of your surgical site. When at home, use clean sheets and clothing and always wash with a clean washcloth. No animals in bed or on the lap after you use your CHG wash or up to 2 weeks after surgery. No baths, hot tubs, pools, lakes, rivers until the doctor approves. No dental work for 2 weeks before surgery and 6 months after surgery. Check with your surgeon first. Be careful with pedicures and manicures as well, because this can increase infection to your surgical site as equally. Stay away from sick people and wash your hands frequently. Remember, mobility is essential to your recovery. When resting or lying down, complete your home exercises that you see on pages 32 to 38. Ambulate with your walker every 2 hours. When in the hospital, call the desk or the nurse's station prior to getting up. Do not ever get up without a staff member or coach nearby. Use your walker for all movement around the hospital room and when you're at home. You may also see the staff use something called a gait belt. This is intended to help you maintain balance during your walking activities. Some additional items to consider is good nutrition. Foods and beverages high in protein can increase your healing process and reduce your risk of infection. Start with drinking nutritional shakes that's high in protein to help supplement your nutrition. Swelling and bruising will occur and increase up to a week or two until after surgery. To help with swelling, remember elevation after activities and completing your ice therapy as long as you possibly can. Wow, what a ride! You finally made it through surgery and the first 2 days of recovery. Here's some information for you when you're getting ready to go home. You can possibly go home the same day that you've had your procedure done or the next morning after your procedure. Our case manager team will meet with you after surgery to coordinate home health physical therapy and make sure you have a walker. Home health physical therapy is essential to your recovery and should last up to 1 to 2 weeks after your procedure. You will receive an additional discharge packet with instructions from the surgeon and a list of medications. However, you cannot go home until you have been cleared by our physical therapy team. They are amazing people. They will teach you how to do your exercises while you're lying down and the best way to use your walker. Remember, your coach will need to be present on the day of discharge. Ensure that they drive an appropriate vehicle for you to be able to get into. So remember, no high riding trucks or SUVs. After you are home and your ride on the way to your home, Use ice and elevation for your extremity to decrease any swelling or pain. It may be time for pain medication at this time as well. Ensure good rest before you start doing your ambulation at home. Try not to make any stops on the way home because this can increase your pain level and swelling. Physical therapy after discharge will teach you how to live with your new knee and your new hip. Remember, your new knee needs stretching and strengthening throughout the day for your muscles. For hips, walking around is very important. Try not to do any extreme movements or activities such as jumping and squatting. To stick to stick to this routine means that your hip joint and knee joint will last a good 18 to 25 years. We will go over when to call for assistance or when to call 911 during your discharge instructions. But here is a brief introduction. When you're in the green zone, remember you are experiencing normal pain, normal swelling, and bruising. Take your pain medication. Remember ice and moderate amount of activity to help with this pain. In the yellow zone, it is time to call the surgeon. You may experience things like redness, swelling, or pain at the incision site. You may have sudden pain in your lower extremities. You also may experience some severe constipation due to taking the pain medications. Finally, the red zone. These are considered emergencies and you should call 911. You may experience sudden shortness of breath, chest pain. Call 911. If your coach or family members are having a hard time waking you up after taking pain medications, call 911. Remember, the reason for having this surgery is returning to the things that you love. Improving your movement and decreasing pain will be well worth this adventure. Thank you for choosing Southside Medical Center for your orthopedic needs. Good luck with your surgery, and I look forward to seeing you while you're here at the facility.